So what exactly is my pelvic floor and what does it look like? The pelvic floor is actually the base of a group of muscles that we refer to as our core. These muscles are located within our pelvis and they extend from the pubic bone in the front to the coccyx in the back. They also extend side to side between the hips, forming a sort of hammock within the pelvis. So if we take a look at the pelvic floor, you can see in here that the pelvic floor is really just a group of muscles. There's several different muscles on the inside that are giving support. If the pelvis is like a bowl, that group of muscles is forming essentially the base of that bowl. The pelvic floor muscles work with your deep abdominal muscles, your deep back muscles, and your diaphragm to help stabilize and support your spine. The pelvic muscles also deal with the pushing down forces in your abdomen and pelvis when you lift or when you strain, such as exercise or coughing or sneezing. A major function of the pelvic floor is to help to support all of our pelvic organs, such as our bladder and our bowel, and for women, our uterus and cervix. Not necessarily in that order. I could fit that in there a little bit better. Not only does the pelvic floor support the organs that are sitting in the pelvis, but it's also responsible for maintaining control and supporting the function of those organs. So it helps us to maintain control of our bladder, such as preventing us from having incontinence. It also helps control function of the bowel so that we don't have fecal incontinence. And in addition to that, it helps with sexual function. So how else does your pelvic floor benefit you? Well, let's go through a couple of examples. If you've ever jumped on a trampoline and had the benefit of not leaking a little bit of urine, then you've got a strong pelvic floor. If you've ever been in the middle of an important conversation or an important meeting and felt the urge to urinate, but knew you had to put it off for a little bit, and you were able to hold it until a more appropriate time to get to the bathroom, then that's the benefit of your pelvic floor. Most of the time, we're not going to notice the importance of our pelvic floor until it's too late and we have a problem. Pelvic floor problems can occur when the muscles are stretched out, when they're too weak, or even when they're too tight. When pelvic floor muscles are weak or stretched out, a woman may notice that she has difficulty controlling her bladder. Now, when she jumps up and down, she's got leakage of urine, or if she gets a sudden urge to make it to the restroom, she has a difficult time getting there. It can also affect the bowel and her ability to maintain bowel continence. So getting to the bathroom for a bowel movement can become very difficult. It's also very common that as women age and those pelvic floor muscles become weak, that they lose control of the anal sphincter and the support of the rectum, and so flatal incontinence becomes much more prominent. I hear all the time from my older patients that they just can't hold their gas anymore. Another issue that can occur from weak or stretched out pelvic floor muscles is something called pelvic organ prolapse. That's when the support that's supposed to keep your organs up in your pelvis becomes so weak that they start falling out of the vaginal opening. Women will notice a bulge, maybe when they wash themselves or they wipe, they feel something there. And it could be that the rectum is bulging up out of the vagina. It could be the bladder is sinking down and falling out of the opening of the vagina. Or it could even be the cervix and or uterus that's coming down. So what are the benefits of a strong pelvic floor? Well, lucky for us, our pelvic floor muscles are just like the muscles in our biceps, our triceps, our quads, and the other muscles that we commonly exercise. And regular activity of those pelvic floor muscles with exercises like Kegel exercises or Pilates or yoga to help strengthen the core and the pelvic floor can help to keep them strong, allowing you to prevent damage that may happen as we get older, or even to help to cure damage that may have happened throughout your life, such as with pregnancy or childbirth or a traumatic injury. Why should you continue to put in the effort to maintain your pelvic floor strength or to increase your pelvic floor strength? Well, let's first address the bladder. One thing that we all take for granted in our youth is the ability to have a good laugh, to sneeze and survive allergy season, or to jump up and down on a trampoline without leaking urine. If you want to keep reaping the benefits of all of those activities without leaking, then you need to maintain the strength of your pelvic floor. It's not uncommon for women to have concerns or complaints about a change in the way intimacy feels as they get older. Usually it's a cause of having had pregnancies and vaginal deliveries that can stretch the pelvic floor muscles and the connective tissue that was formerly holding everything together. This sensation of laxity in the vagina is often a result of a relaxation of the pelvic floor muscles. So if you want to get a better sensation back when you're having vaginal penetration, one thing you can do is strengthen your pelvic floor muscles. Did you know that when a woman has an orgasm, it's actually a series of contractions of the pelvic floor muscles? So if improving the quality of intimacy with your partner, the level of orgasm that you're having is important to you, then it's going to be important that you strengthen your pelvic floor. So we've talked about bladder control. We've talked about bowel control. We've even discussed the impact that our pelvic floor has on our sex lives. And last but not least, did you know that the number one reason that people present to their physician in the United States is low back pain? And one way you can help to decrease your risk of low back pain is keeping a strong core. And let's not forget, as I said earlier, your pelvic floor is a part of your core, and it helps to stabilize and support your lower back and your spine. Now I hope you have a better understanding of your pelvic floor and how it impacts your life. And I also hope you have a better understanding of the benefits of having a strong pelvic floor, because it's not only going to help with your strength and your function, but it's going to help to maintain an overall better quality of life for you. I want to thank Elvie for partnering with me for this video. It is one of my favorite areas to discuss. As a urogynecologist, I have dedicated my life to taking care of women and supporting them with their pelvic floor health and pelvic floor dysfunction throughout their lifetime. Bye. Thanks.